The COVID-19 pandemic poses a major threat both to our physical and mental well-being and of the entire society, making it a priority that must be urgently addressed. Hardships caused by negative socioeconomic effects, fear of the virus and its spread, and other related concerns have significantly impacted the mental health of the population worldwide. Welcome to our pre-celebration for World Mental Health Day here on PAHO Caribbean. This year's theme is mental health care. Let's make it a reality for all. I am your host for the day, Tanya McFall Major. Let's meet our panel. Today we have Dr. Renato Oliveira. Welcome to the team.
Hi, thank you.
We have Ms. Sahar Vasquez.
Thank you.
And we have Mr. Franco Mascayano.
Hi.
Welcome to our team, welcome to our panel today. And we want to welcome everyone, our audience. Thank you for spending time with us. Share the stream with your loved ones and those that may need to strengthen their mental health. Post your questions, post your comments right on our page and get the facts here. So improving mental health here at PAHO is a top priority. And we know that we've experienced it all. We've experienced whether it was fear, depression, anger, whatever sorts of emotions that we've all experienced. We know that we've had some kind of impact from the COVID-19 experience. But let's begin today with some questions. Let's start with you, Renato. What mental health consequences of COVID-19 has been observed in the region, and which populations have been most affected?
Thanks very much for the question, Tanya. That's a very important question these days. You know, we all have been going through a lot during this pandemic. And I think whoever is the person that you ask, the person will be able to describe what has been the impact of the pandemic in the well-being of the person or of family members. But we here at PAHO, we have also been trying to put together the studies that have been conducted and also published in our region to also try to understand what is the impact of the pandemic on the mental health of populations. And there are quite a good number of studies in our region, and the studies, they point to a very similar direction. There is an increase in anxiety, there is an increase in depression in different countries where the studies have been published. We also have some studies showing that even like mental disorders seem to have increased during the pandemic. Another very important finding is that people that already had a previous mental health condition, they now during the pandemic, they have a higher probability of having a relapse. And we also have observed that people who were following treatment, who were following care, they don't have access to the treatment anymore because the services have been closed or the person is not able to move to the place where the service is offered. So basically, there is a deterioration on the mental health of the population of the Americas. That's a very important concern. And that's, again, the reason why we are here talking again about mental health, while we commemorate the World Mental Health Day. You had also asked, Tanya, which populations are more vulnerable? Well, studies have also pointed to some directions. And this is a very important question because knowing populations that are more vulnerable helps us when we are developing services, when we are supporting, in fact, countries to develop services, to advocate that those specific vulnerable populations, they are prioritized. So we know that children and adolescents are more vulnerable. Also obvious, no children have been out of school, have not been able to socialize. Many times they have not been able to play as they were doing before. So this has an impact on their mental health. We also know that the indigenous populations having less access to information, having less access to services, they are also a vulnerable population. And I should also not forget, and this is so important today, health professionals. So the people who are really on the front line of the emergency response, being exposed to the virus, many times isolated from their family members. You know, in many places, the protective equipment is also not sufficient. So this just add layers of stressors to our health professionals, so we know that they are a particular vulnerable group. And here I just also wanted to mention that we are taking this opportunity to launch a campaign called Tell Your Story, where we are really inviting health professionals to bring what they have gone through, but also the lessons and the tips and the skills that they have used to overcome such difficult times. And I should also not forget that we will be launching a virtual course for health professionals based on self-help. It should be ready in a few weeks. So I hope I have answered your question.
You have, and you brought, as you spoke, some questions came to mind. You highlighted children in particular. How is it, well, anyone from the panel can actually pitch in for this one. How can we tell if our child is experiencing anxiety as a result of COVID-19?
Maybe I can try to start, Tanya. You know, about children depends on the age and on the development stage of children. Really, we start to be worried when we observe that children have changed their pattern of behavior, either being more irritative or being more isolated. So parents know their children. I'm a father, so I can really observe when things are not going well. A child can become withdrawal, or is not sleeping anymore well as he or she was sleeping before. So those changes of behavior really should raise an alert for us parents, especially if these changes are persistent. That should be a cause for concern, and of course then parents would need to search for help and talk to someone who can advise them on how to help the child.
Thank you for that. Sahar, what can we do? We realize that someone is struggling with a mental health issue. What can we do to help that person?
I think one of the main things you can do is just being there for them and letting them know that, you know, they're not alone in this feeling. We all have mental health, and, you know, it can feel very lonely at times. And I think we need to get to a place where it doesn't feel lonely. Just like when you have a serious physical illness like cancer, diabetes, you don't feel alone because so many people share their battles and their stories. So I really hope that we can get to a place with mental ill health where everyone is talking about it, so no one feels alone. And I think people also need to know that, you know, there's a lot of information and help out there for them. So, I mean, I know it's not always free, but there is help and there is hope out there. So for me, that's my biggest thing.
And you've raised a good point, Sahar. But for persons who may not be certain, there is a lot of information on our PAHO page. So you can also check out our www.paho.org/en if you need additional help, and continue to share the information that's helped those that need it. But I wanted to add something else, another dimension to what you talked about, Sahar. You talked about the things that we should do. But here in the Caribbean region, there may be some things that we do, we may have some tendencies to do things that does not necessarily help those who are experiencing mental health challenges. Tell us some of the things that we should not do.
I mean, I'm certainly guilty of doing some of these things, but I think overindulging in excessive alcohol drinking is certainly one of the things you shouldn't do. And in the Caribbean, it's very cultural to start drinking, I don't know, from Wednesday, you know, and that's seen as kind of like a stress reliever. And so for me, that was something I did, and it became a problem in my life. It started, you know, invading into my work and personal life. But when I cut it all out, I was so much better. So that's my biggest thing. And I see so many people in my country, you know, just get lost in that drinking habit. So definitely don't overindulge in things that are pleasurable, but they're not long-term fixes. They're quick fixes, right? Whether it's drinking or excessively eating sweet things, whatever it might be. But in the Caribbean, for me, it's drinking. Is what I have observed.
And that is true. So we have everyone you're hearing, please, let's find those positive coping methods. We don't want to do the negative. We don't want any negative consequences. So stay away from the overindulgence, the alcohol and tobacco. And thank you for Sahar for sharing part of your message, part of your story with us. So let's go to Franco. I know Franco is anxiously awaiting to join the conversation.
Yeah, a little bit, I have to say.
How has the COVID-19 pandemic impact the mental health of healthcare workers in the region? We've lost so many healthcare workers. We've seen so many of them struggle going to work daily, where many of them feel as if they're surrounded by death. So how has their mental health really been impacted?
Right. So thank you for the question. And I think that Renato answered this question a little bit before, but I'm going to try to add to what he said. So some of you may know that we've been conducting this regional and also global studies called HEROES. It's focused on evaluating the effects of the pandemic on the mental health of healthcare workers, both professional and non-professional healthcare workers. The biggest region in the study is the Americas, especially Latin America. We have like 12 or 13 countries involved. The study is heavily relying on the countries in the region. So that's a feature that I would say is not really common in global health. That's the global studies led by Latin America. So I have to say that every time they refer to HEROES. But the focus has been evaluating the effects of the pandemic. As Renato said, we have found increased rates of depressive symptoms, anxiety, mental distress, suicide ideation in some countries, especially in Bolivia and Chile. In Bolivia, just to give you a number, 15% of the people that we enroll reported suicide ideation and sometimes suicide attempts. I'm referring to this population, right? Healthcare workers. Factors that are related to increase mental health issues in this population are profession. I think you already talked about frontline versus non-frontline healthcare workers. So we see increased rates or higher risk among frontline healthcare workers. Just to give you another example, one of the locales in the study is Sao Paulo, and Sao Paulo is really special, not only because the magnitude of the pandemic there has been huge, but also because we have a pre-pandemic measure. So we are comparing pre-pandemic versus during pandemic measures, and we have found that among physicians, among nurses, among nursing assistants, there was a higher risk in all these mental health outcomes when compared with the measure before the pandemic, right? So that, to me, is the best evidence we have for this population in the region. So our hope has been since the beginning that could inform interventions and policies. But there are other factors that we should keep in mind too. I'm going to just mention a few. For example, stigma, violence, and discrimination. Sadly, at first, this population was appraised and was, acknowledged, and there was many campaigns, and that's why we call the study HEROES, by the way. But then we heard several reports of, discriminated behaviors, actual violence, towards this population in Brazil, in Mexico. So obviously those people who have experienced, stigma and discrimination are at higher risk of mental health outcomes and negative outcomes. I mean, training and capacity. Many of these people had minimal capacity before the pandemic hit, and many of them didn't receive proper, training till later on, and I guess in a few places in the region, they still haven't. Gender differences. Many women reported that they had, inadequate access to PPE, or the PPE wasn't appropriate for them, compared to men. And there are other factors like resilience, like resources in place, formal and informal supports that really make a difference. So To sum up and answer your question, the impact of the pandemic has been huge, but we have to consider all these factors to identify people at risk and to identify those who will really need help in the future.
Thank you for that. So let's go on. We know that as a result of the pandemic, healthcare services worldwide have been heavily impacted. But we don't often take time to think about the impact, the mental health care services, how they've been impacted. Renato, would you care to share about that?
Yeah, sure, Tanya. That's again a very important question, because what we have been describing here is the impact of the pandemic on the mental health of the population, with the increased anxiety, increased depression. And now we are basically looking at the other side of the story. So how are the services that are supposed to help people in those difficult situations? So how are mental health services functioning during the pandemic? And in fact, we at the Pan American Health Organization, with the World Health Organization, we have conducted two studies where we sent questionnaires to the countries in the region, and in an attempt to understand how essential health services were basically functioning during the pandemic. And well, when we compare the mental health services with other services like immunization, reproductive health, in fact, in the last round of the survey, we could see that the most disrupted services were in fact mental health services. So 60% of the countries who answered the question and basically said that the mental health services were not fully functioning. So that's a bit of the photo that we have today. On one side, increased needs, and on the other side, the services not functioning as they should function to cater for those needs. So that's a worrying situation. We know that, in fact, some countries have changed the way that the mental health services operated. They shifted to online services, to hotlines. So that's very positive, and this is something that should continue towards the future. But the sad reality is that there is a good level of disruption of mental health services today, even mental health services that should be in emergencies. And that sometimes are life-saving, like care for people who are withdrawing from substances or opioid replacement therapy that some countries had previously. So those services are, in fact, in many places disrupted.
And we want to take the opportunity to encourage persons, if you need, thank you for that, Renato. We want to take the opportunity to remind persons, if you have access to these mental health teleservices, take full advantage of it. Take full advantage, get the help that you need, it's available. Whether it's a WhatsApp hotline, whether it's one-on-one sessions via Zoom or whatever platform, take full advantage. Your health and your mental health is important to all of us. And as we talk about health, and you talked a little bit about
that. I'm sorry, Tanya. I'm sorry.
Go ahead. No, go ahead. Go ahead, Franco.
Because I think that what Renato said is very important, and especially for some populations. I work with people, with young people with psychosis, early psychosis, first episode psychosis. Part of my work is in New York, but I have several projects in Latin America. And I think for that population in particular, it could be really challenging to offer online services or virtual services. We have tried that several times, and sometimes it's just they don't get it, they don't like it, they prefer to see people like, in person.
Yeah, that one-on-one experience.
Yeah, so it's been difficult for us to offer services, to follow up on people, and that has happened everywhere, really, not just in the region. But the point I wanted to make is that for some vulnerable populations, I think we need to do some extra efforts and see how flexible we could be to identify those people at risk and to offer, appropriate treatment. It's challenging again for everyone everywhere. But to me, at least, like like a psychosis researcher, I think sometimes for whatever reason, those people are really, neglected. I don't know why, but they should be prioritized in my opinion.
So Franco, what suggestions would you make that based on your experience that we can make this service more available to persons who may not, like you say, may not like the teleservices, or it may not be accessible to them? What type of examples would you make or suggestions would you make?
So I think the key point is flexibility. I know that teams, everywhere have the best disposition, they want to help, but sometimes, they don't have the resources and they have just one way to do stuff. And I feel that if you are facing, a pandemic like the COVID pandemic, you have to be flexible. I mean, you have to find a way to identify what works for a particular person. And if, Zoom, video conference doesn't work, you have to try telephone, you have to, make a visit, you have to be flexible, see what for a particular person would make sense. So I know that will require like a lot of resources and like a good and well-organized team. But I think that what I have seen, work in for example, high-income countries, So I know that there are big differences, but I think there are some good practices in terms of flexibility that we can, learn from, and that I know that at least for this population could work.
Thank you for that, Franco. So let's go back to Sahar, and you started to share your story with us. And we wanted to find out what helped you most in your recovery.
I think for me, it was my family. I know I'm very lucky to have unwavering support. I don't know how they put up with me through everything that I guess I did and how I behaved, but they did, and that helped me the most. And I think also just realizing that I was gonna keep going backwards if I didn't start doing something about my, making my life something more positive. So that was really, I think that really flipped the switch for me. And, I gave up all drugs and alcohol, and I started taking therapy seriously. I took my medicine, and I think this is the best I've probably felt in about 6 or 7 years. The most productive, the most, I guess I want to say fresh, and, just ready to go I felt in a very long time. So, I know that these quick fixes, they make the pain go away immediately, but in the long term, it only causes more damage. So I think my message would be just to encourage people to, give therapy a try, give your medicine a try. It's, it can be annoying, but it really does work, and it will change the quality of your life. I mean, it's not perfect. I still have my days that are tough, but I really feel so much better.
I want to say congratulations, Sahar, for the step that you've made. And you can be an example to so many persons within our region. So congratulations for your 6-year achievement. And I want to open this question to everyone. In our region, we know there's still, even though the conversation has improved, has increased in our countries, there's still stigma surrounded around mental health. So we want to hear from everyone. How can we reduce the stigma around mental health and promote mental health in our communities?
Well, if I can go first, if that's okay. Well, I'm a teacher, so I teach 2nd grade, and I feel like it all starts there, from the youngest, from 3-year-olds, teaching them that we all have feelings, we all have emotions. So when we're feeling sad or mad, that's okay. It doesn't mean that there's something wrong with us. It means we're human, and our brain is working, and teaching them as well how to cope with these feelings, because in my country there is a lot of violence, and I feel that we can really change the narrative of all this violence if we implement social and emotional learning, teaching our young people how to be emotionally intelligent. How can they cope with the chaos of this world? There's so much to be angry at, and so how can we learn to deal with that? So I think that's very important in breaking the stigma, just introducing it from a young age. So that would be what I would have to say regarding that.
Thank you, Sahar. I see that we have a comment from Facebook. Hi, Michael. Michael is saying that it's a great idea to be more understanding on the issue. And I agree. And based on what Sahar says, is an example of the role that our teachers, our educators can, that they can do, that they can help, they can play in promoting mental health in the region. Leticia from Facebook is saying hashtag healthcare workers mental health. Yes, we agree. So Renato, Franco?
Maybe
you can go first.
Maybe I give it a try. In fact, that's an area that is very, very important, if not one of the most important for us at our unit here in PAHO, Tanya. We are developing, and we have developed a course for health professionals on how better to understand stigma and how to improve their attitudes towards stigma and people with mental health conditions. So this is something that I also encourage the countries to learn more about how to combat stigma. Our course is running now. People are participating. Probably we are going to launch the course again next year. So we really encourage that people, when the course is available, they join. We are also here available to help if there are organizations at the country level that need our support, that want to develop these courses for health professionals. We are also here to support. So that's I think another thing that we can do, and we try to play our part from the health professionals perspective. Not saying that the problem of stigma is only related to health professionals. It's related to everything. Unfortunately, people with mental health conditions, they are stigmatized from different levels and from different perspectives. We have been trying to play our role on providing knowledge and information and skills for health professionals in general, that because in fact many times they did not have access to that information, and it's difficult for them to relate to things that they probably don't have full knowledge and understanding. But Franco is a specialist in this area also, so I'm sure he's going to have a lot to contribute.
Thank you for that, Renato. I want to just read two comments before you begin, Franco. So we have a comment from David Johnson. Hi, David. David says, absolutely, we must reach a point where people's feelings are validated. Yes. And Lydiana Raming from the Bahamas, continue to promote the importance of mental health. Thank you. Please continue to share the link, share the live stream, post your comments, ask your questions. Our experts are here to assist you today. Franco?
Yeah, sure. So that's a great topic for sure. I dedicated part of my career to study stigma and discrimination and different contexts and for different people. And I think that probably the most valuable lesson I have learned is that the best approach to tackle stigma is to let people with lived experience to talk about their problems. Ask anyone, ask Patrick Corrigan, ask the experts, in the world, they would say the same thing. We need to try to let their voices to be heard. It sounds more easy that what's actually is, but it's crucial. And I think that many campaigns and programs and interventions have tried to do that, but many times, almost all time, the people with lived experience play like a very minor role. They are like consultants, and that's it. I feel that the most successful interventions have had people who live experience, actually delivering the intervention, delivering the message, and saying, if we're going to talk about my journey, my personal recovery, let me talk about that. If you want to help me, to evaluate, for example, to assess the impact of a particular intervention, okay, no problem, we can collaborate, right? And we researchers, we will do our part, but if we're talking about, personal stories, lives, we have to let people live experience, to have a voice. And that's like our, duty. And that's what I've been trying to do, at least, in the last 5 years. And I'm so glad, to see Sahar, to hear about her story. I think it's really influential. And the spaces like this is what we need for sure.
Thank you so much, Franco. So what can governments do to address the impact of mental health and COVID-19 on the mental health? And what support can they give to the communities?
Should I try? Should I start?
Anyone can jump right in.
Okay, so maybe I can start, and then I'm sure colleagues are going to complement. First thing is to invest in mental health. So we have been talking so many years on we need to scale up, we need to make mental health services available, we need to create systems inside the community at the primary healthcare level. This all, no doubt, this needs to be done, but this is only going to be done when really financial investment goes towards mental health. So this is what we in fact discuss in our dialogue with the countries in the region. Please put more resources in mental health. That's the only way that we can provide the services that people need. And without that, we are not going to be able to move forward. So that's the most important message in my view. There are many other things that need to be done, no doubt, Tanya, but it starts with investment.
That's a very great point that you made, Renato. David says, I think another crucial element in the fight against stigma is introducing or renewing national mental health policies, mental health wellness strategies. Governments must communicate to their population that their mental health is valid. That's a very great point, David. Sahar, what about NGOs and other community-based organizations? What can they do to help to improve the mental health in the community?
I think as NGOs, something important for us is to provide a voice for everyone around us, to listen to their concerns and present these concerns to those people in power. They have to be held accountable. They were elected to be leaders, and they make all these promises. So now we must push to ensure that they deliver. And I think what Renato said is very powerful. We talk about investing in our health, and part of our health is our mental health. So we must invest in it. We have to, I think one of the biggest steps is for governments to listen to us as NGOs, as advocates. I think sometimes I feel that because maybe I don't have a degree in psychology or anything, I just have a degree in my lived experience, they tend to brush that under the rug. But I think, like Franco said, that might be the best degree you can have, because you're speaking from a very personal, real place. So I think they need to listen to us more, and just acknowledge that, we're in a mental health crisis. Just like we're in a health crisis, we're also in a mental health crisis for kids, adolescents, elderly people. We're all suffering, and we need to acknowledge that, and just know that we're in it together.
Thank you, Sahar. Franco, what lessons can we learn from the pandemic on protecting the mental health of our future, of our healthcare workers for their future?
Yeah, that's a good question. I don't know if I have a good answer for it, but I'm going to try. I think what we learned at the beginning was, as I said before, that this population was apparently prioritized. They were recognized as heroes, as people, that were at higher risk of developing, not only mental health issues, other issues too. But that changed as the pandemic advanced. I don't know why, but I think that's a very important lesson. If governments and institutions, organizations can provide both formal support and promote informal support, that would make a difference. And this is a study that I was referring to in Sao Paulo. We found that family support and formal support at the workplace was really related to depression. So people that had received, in both supports, reported like lower risk of, probably depression. That's the outcome we use. So I think that we should keep that in mind, but we know that there is an issue not only about offering those services, but also about implementing those services. So that's something that, Renato and I have discussed before. There's an issue about implementation. So I think governments and institutions want to help. They have something in mind, something in paper even, but the translation of what they can have in a guideline to reality into, regular mental health services could be really problematic. So there's this other study we have associated to HEROES. It's about evaluating policies in mental health for this population. And we found that many countries actually have something, right? Have published, guidelines and stuff like that. But when we interview people, when we interview healthcare workers, they say we have no idea about those services. We didn't know that that was available, So that's another lesson that's quite important. It's not only about coming up with new services or, strengthening the services we have. It's also about how we can translate what we're proposing into reality. And it's kind of obvious what I'm saying, but in time of crisis, that could be even more relevant to have in mind.
Based on what I'm gathering from the panel's statement today and how we can help to improve mental health services and mental health for our communities, particularly for our healthcare workers, are to invest, to advocate, to implement, promote, and to make it a reality. So it has to be services that are effective to helping our people. And I want to say a special thank you to our guests today, Renato, Sahar, and Franco. We thank you for your contributions. To those participating on the various social media platforms and our websites, we say thank you for participating today and sharing with us. If you have any questions or need information on any public health topic, feel free to visit our PAHO Caribbean pages on Facebook, Instagram, Twitter, or visit our website at www.paho.org/en. And we also want to remind you of our Tell Your Story campaign that focuses on health professionals in the region. And you're invited to participate by telling your story. This campaign will be launched on this Sunday, which is Mental Health Day. Make a note on your calendar. And it aims to raise the awareness of the impact of COVID-19 on the mental health of our healthcare workers. Again, we say thank you, everyone. Have a happy World Mental Health Day, and let's make mental health a reality for all.
How can you help a person who is grieving during COVID-19? Listen carefully, but don't oblige them to talk. Ask about their needs and concerns. Help them take care of their basic needs and connect with family and other sources of social support. Encourage them to resume their daily activities at school, work, home, and in social relationships. Crying does not mean a person is weak, but people who do not cry may feel emotional pain as strong as those who do. Recovering and adapting is a process that takes time. Finding a moment for closure can help the process. It's important to say goodbye. If the pandemic doesn't allow for the usual rituals, here are some alternatives. Gather everyone in your household around a lit candle, perhaps with a photo or drawing of the person who died. Share special memories or thoughts about them, or what each person would like to say to them while the candle is lit. Wait until the candle goes out or blow it out altogether. Organize a meal with family or friends and leave a chair or empty space where you can place a photo or drawing of the deceased. Give everyone an opportunity to express meaningful feelings about the person who died. Write a letter to the person who died, telling them everything you still want to say to them. You could also bury an object owned by the person who died, following a ritual similar to a funeral service. Sometimes the grieving process does not close properly. Complications develop when, after 2 or 3 months, the person still feels very intense unease, extreme longing for the loved one, or great difficulty in performing daily activities. the person resorts to harmful behaviors such as excessive alcohol or drug use, gambling, or use of technology. In such cases, it is important to turn to professional help. It is normal to go through a grieving process, and the reactions will be different for each person. Support should be provided to grieving people. If the process becomes lengthy or complicated, it is important to ask for help.